what are we going to do? These drugs are not safe. The cost long-term is far, far too extensive to say that the immediate pleasures are worth it. We have in the US the most overdose deaths, the most cannabis use disorder, the most use amongst 12th graders, the most daily use, and so on. The drug supply is surging worldwide. There are more potent marijuana, more use in pregnancy. And California responds by putting up a sign saying, if you're going to use fentanyl, use it with friends. This sign caused so much umbrage that they had to take it down. It was enabling, it was normalizing, instead of, this is a disaster, a potential death sentence for you. Oregon tried to decriminalize all drugs with a wishful belief, oh, this is what we're going to do. It was Measure 110. We're going to decriminalize. The people who sponsor the bill were the same people who sponsored marijuana legalization. They're the same people who are sponsoring legalization of hallucinogens in our country. Let's remove the criminal penalties. Let's not criminalize drugs. Let's reduce harm. Let's allocate $250 million for treatment and for naloxone. Let's end penalties and reduce the stigma of drugs, and a belief that everything will be cured with this proposition. And just April 1 of 2024, less than a year ago, they rescinded it, they removed it. Every single wish they had didn't work out. It was racial justice policy, except that the African Americans were the most vocal critics of it because their community suffered the most. Drug overdose deaths soared, increased by over 40% in that time. Overdose deaths were just the highest of any state in the nation. They said everybody has a chance to seek treatment. If they're caught with a drug, we're going to give them treatment on demand, and if they fail, they'll get a $100 ticket. Nobody showed up for treatment. They had open-air drug markets and violence, and the gentle pressure to seek treatment failed completely. And so their belief system disintegrated within 3 years. And they knew this was a failed policy. What lessons have we learned? We've learned that if we ignore the history of drugs, and if generations forget, we're going to have more use. If we don't educate physicians and the public with scientific literacy, we're going to have more drug use. If we're going to believe that these drugs are safe and they're medicine, we're going to have more. If we're going to allow the medical community to be pressured into prescribing, we'll have more. If we're going to allow vast sums of money to promote the drugs, we're going to have more. If we're going to conflate medical and recreational drugs with a distinction that cannot be enforced, we'll have more. If we use ballot initiatives instead of the Food and Drug Administration to approve drugs, we'll have more. If the benefits are allowed to be exaggerated, the risks are minimized, and skeptics are ignored, we'll have more. We're going to have a new wave of unregulated high-potency drugs. It never stops with one. We're going to have diversion of medications and rogue clinics pretending that they're treating people. And the media has been enlisted to promote this. This is what's happened. So the US pipeline keeps filling with drug use and disordered use. 87 million people currently using drugs. And what do we do about all of these drug categories? We have to encourage evidence-based treatment. We need law enforcement to uphold the Controlled Substances Act with interdiction and disrupt production. With prevention and intervention, we need universal prevention. We need to try to divert young people from recreational drug use into activities. We have to focus on families, on schools, and on screening and brief interventions in healthcare settings. And I believe we have to focus above all on parents, and I'll give you the evidence. Why are parents such an untapped resource? Because of their impact and because their knowledge gaps. I have spent many years in the United States and other countries, and one of the most common refrains I hear from parents is, if only I knew. If only I knew. Let's talk about the influence of parents. The risk of a child's drug use is much less if parents don't use drugs. The risk is much less if they disapprove of drugs, if they set boundaries, if they monitor a child's homework, activities, and friends, and if they establish trust and a supportive environment for discussing drugs. This is a study we published a little while ago with the CDC as well as NIDA and SAMHSA, 3 federal agencies and one aging old, pearl-clutching woman. And what we found is that if parents use drugs, the more frequently they use, the more likely their 12 to 17-year-olds use, the more likely their 18 to 30-year-olds use. If parents disapprove of drug use, their child is much less likely to use drugs. Much less likely. And in the United States, the parents that disapprove of drugs most are Asian parents. And the drug use amongst Asians is the lowest amongst all ethnic and racial communities. If parents are authoritative, they reduce the risk of drug use in their children. All categories of drugs. But there is good news, and sometimes the good news, we don't even know the cause. In this case, I think we do. We have seen since COVID the largest number of 10th, 8th, and 12th grade students electing to not use drugs at all. Not alcohol, not tobacco, not marijuana. It's unprecedented in our history, unprecedented. And we thought after COVID was over, drug use would go back up. It keeps going down. For alcohol, illicit drugs, marijuana, being drunk, nicotine vaping, and marijuana vaping, it's declining steadily. COVID may have increased parental oversight because the kids were at home. They were supervised. It disrupted peer groups that passed drugs around. It replaced social groups with social media. And the decline persisted to this day, which means that we have delayed the age of onset of drug use in adolescence. It could prevent youth from joining drug groups, and it could disrupt biological processes that foster addiction and consequences. So there is hope. But why should we target parents? To tell them what the risks of and for using drugs, to help them open conversations about drugs. And Harvard, the Vice Provost's office, has accepted my request to sponsor a course for parents that is universal, that is going to be available on the web for anybody in the world, free of charge, to help them learn about drug consequences and to help them learn how to engage in conversations and to help them reflect on their own attitudes towards drugs. There are 5 modules. on what the influences of drugs on children are, what the risks are, how to discuss drugs with their children, how to use the information cleverly, and self-reflection. The key points are knowledge and action for parents. And we hope that this will spare young people who walk on that lonely journey towards adulthood, spare them a lifetime of agony if they journey and make choices that are detrimental to them. And instead, if they journey down this tunnel and make choices that are healthy for an optimistic and hopeful future. I will close by saying the most important thing in a life that I have lived here is that I don't consider this a war on drugs. I consider this a defense of our brains. Our brains are the repository of our humanity. This is what distinguishes us from all other life forms. Our ability to create poetry and music, to create rockets and iPhones, to send New Horizons rocket to Pluto 3 billion miles away and miss the target by 1 mile. One of my friends, an astronomer who was involved, he was very much involved in that mission, said it was only a mile off after 3 billion mile journey. The brain is the repository of us as humans, to engage in laws, to engage in justice, to engage in scientific creativity, to engage in poetry, whether we create ourselves or whether or not we avail ourselves of the creativity of others. It is our brain that enables us to be human, and we have to defend it from drugs, which is the greatest threat to our brains. Thank you.